The Department of Veterans Affairs is conducting the largest outreach campaign in its history, focused on bringing even more veterans to VA under the PACT Act. Since the beginning of its effort, nearly 740,000 veterans have enrolled in a VA healthcare. Now, Mr. Adam Farina, Assistant Secretary for the Office of Public and Intergovernmental Affairs in the Department of Veterans Affairs, is here to join us. Good morning. How are you?
Good morning. I'm good. Thank you so much for having me on.
Thank you for joining us, Adam. Where does VA attribute its recent success in outreach efforts?
Yeah, so 2 years ago, President Biden signed the PACT Act into law. It's effectively the biggest expansion of veteran benefits since the GI Bill, and it made millions of veterans eligible for health care and benefits that they weren't eligible for previously. And when that happened, the president and Secretary McDonough gave VA a mandate, which is to reach out to every one of those veterans who's newly eligible for care and benefits and make sure that they know what they're eligible for and make sure that they're coming to us for it. And so since then, we've launched the largest outreach campaign in VA history, hosting thousands of events across the country, sending millions of text messages and emails to veterans, hosting a nationwide advertising campaign, basically doing everything in our power to deliver one message to veterans, which is that we are here and we want to serve you and provide you with what you've earned. And as a result, we're currently delivering more care and more benefits to more vets than ever before.
Now, do you think VA can keep this positive momentum going?
That's certainly the goal, and we're keeping our foot in the gas pedal. Our goal is to build a VA where veterans don't have to come to us, where we actually go to them and fit into their lives. And that's why we've been hosting events all across the country. We recently have had events in places like Yankee Stadium and places like Cincinnati Red Stadium. We even have hosted barbecues all across the country and recently went to the biggest motorcycle rally in America. Wherever veterans are, we are trying to be and trying to fit into their lives and into their everyday efforts. And as a part of that, we recently had one veteran come to one of our barbecues. He's a Vietnam veteran who wasn't previously eligible for care benefits and is now eligible. And for the first time, 50 years after serving our country, was able to get access to health care at VA. That's what this campaign is all about, reaching veterans like that, reaching veterans who have served over the course of the past 50 years, and encouraging them to come to VA because veterans who come to VA are proven to live healthier lives.
Now, Adam, there are a lot of negative perceptions about VA. What do you have to say about that?
Yeah, absolutely. I would just say to veterans, this is not your grandfather's VA. VA healthcare outperforms the private sector across every metric, including patient satisfaction, star ratings, quality ratings, wait times, you name it. But the metric that matters most to us here at VA is veteran trust. And we recently conducted a survey of 440,000 veterans who showed that they trusted VA at a 92% level with their healthcare. That's not something you would see in the private sector. It's not even something that would be measured in the private sector. And so, to any veterans who've had bad experiences with us in the past, we encourage you to give us another chance. And if you've never come to us before, give us a chance for the first time. We are going to do everything in our power to earn your trust every day with every interaction because that's what you deserve.
Speaking of trust, can you highlight the services you provide for veterans?
Absolutely. So there's VA healthcare, and under the PACT Act, all veterans who served in Vietnam, in Iraq, in Afghanistan, in the global war on terror, in the Gulf War, all of those veterans who were exposed to toxins while serving our country are now automatically eligible for VA care. Additionally, we provide disability compensation benefits. That's monthly payments for veterans who have conditions that followed them home from war. So, for example, if you're a Vietnam veteran who got hypertension, for example, as a result of your service, we are able to provide monthly compensation benefits for that condition and for many other conditions that can follow veterans home from war. Additionally, we have GI Bill benefits, which can help you get an education, home loan benefits, which can help you buy a home with no money down, and even memorial services for veterans who are at the end of their lives and need to be honored in one of our national cemeteries. And really, we want veterans to come to us for any of those care and benefits, and we will make sure that we get you the full suite of care and services that you deserve from us.
Now, Adam, what's your message to veterans and where can veterans go for help?
First of all, there's no wrong door to come to VA. So you can visit us at va.gov and apply there. You can call 1-800-698-2411, or you can come to us at any of our healthcare facilities across America, and we're going to get you the help you need. And our message to veterans is this. You have fought for our country. You have served our country. We are so grateful for your service. And now it's our job to serve you. And that's what we come to work to do every single day at VA. That's what our 450,000 employees come to work to do. And we want to serve you just like you've served our country. So give us a chance. Come to us for your health care. Come to us for your benefits.
This figure, Mr. Adam Farina, Assistant Secretary for the Office of Public and Intergovernmental Affairs in the Department of Veterans Affairs. Thank you so much for joining us on Morning Blend.
Thank you.